Steward Health Care is filing for bankruptcy. The company says day-to-day operations will not be impacted at its 9 hospitals in Massachusetts during restructuring. Steward says the move is in the best interest of its patients, physicians, employees, and communities. The company, of course, in millions of dollars of debt. The Massachusetts Nurses Association and United Healthcare Workers East just issued a joint statement this morning saying in part, the administration, the legislature, the healthcare industry, and all those who value the health of our communities should immediately take whatever steps are needed to ensure the preservation of these facilities and the safe transition to a more stable and responsible not-for-profit ownership.
On May 6th, 2024, Steward Health Care, a sprawling hospital network, filed for Chapter 11 bankruptcy, sending shockwaves from the corridors of power in Washington, D.C. to the quiet community hospitals that formed the bedrock of its empire. This was not just another corporate failure. This was the collapse of the largest physician-owned and largest private for-profit hospital company in the United States. At its peak, Steward was massive, a testament to a new, aggressive model of healthcare delivery. It operated more than 30 hospitals nationwide, a coast-to-coast network stretching from its origins in Massachusetts all the way to Arizona, making it a major player in the healthcare landscape across 9 states. The company boasted of employing tens of thousands of people and caring for millions of patients annually. The architect and public face of this empire was Dr. Ralph de la Torre, a cardiac surgeon by training, who transformed into a healthcare magnate. He was once described as a rising star among physician executives, ambitious, talented, and possessing a tremendous edge. He was the visionary who took a struggling set of non-profit hospitals and, with the backing of private equity, promised to forge them into a thriving, efficient system. In its early days, the company he led was lauded, even receiving top awards for quality and safety, seemingly proving that the for-profit model could indeed rescue community care. The promise was immense: to turn around struggling hospitals, improve outcomes, and lower costs, all while operating as a successful business. For a time, it appeared to be working. Steward grew at a breathtaking pace, acquiring hospital after hospital, its name becoming synonymous with a bold new chapter in American medicine, which makes its implosion all the more staggering. The bankruptcy filing revealed a company drowning in over $9 billion of debt, unable to pay its vendors for basic medical supplies, and leaving patients and entire communities in a state of crisis. The question, then, begs to be asked: how did it all go so wrong? How did a system so vast, led by a figure once seen as a visionary, collapse so spectacularly, leaving a trail of shuttered hospitals and shattered trust? How did the promise of rescue curdle into a reality of ruin? To understand the fall of this house of cards, we must first understand the rise. And the best place to start is at the beginning. The Steward story begins in Boston in 2010. Cerberus Capital Management, a New York-based private equity firm, acquired the financially struggling Caritas Christi healthcare system from the Catholic Archdiocese of Boston. The price tag was roughly valued at $895 million. With this transaction, 6 non-profit community hospitals were transformed into a new for-profit entity, Steward Health Care. At the helm was Dr. Ralph de la Torre, a former cardiac surgeon who had been CEO of Caritas Christi since 2008. De la Torre, the son of Cuban immigrants who fled the Cuban Revolution, grew up in Florida. He obtained a bachelor's degree in engineering from Duke University and would later obtain both his doctorate in medicine and master's in science degree from a joint program run by Harvard and MIT, described as ambitious, highly talented, and with an affinity for luxury. De la Torre was the public face of this new venture. He had successfully restructured Caritas in his first year, turning a $20 million loss into a $31 million income. However, he believed long-term survival depended on a significant cash infusion, particularly to secure the underfunded pension plan and preserve jobs. This belief led him to Cerberus. The initial promise was one of rescue and revitalization. Steward, backed by Cerberus's capital, would save these struggling Massachusetts hospitals, enhance their efficiency, and deliver quality care under a new for-profit model. Cerberus put up $246 million in cash to acquire Caritas Christi and convert it into what would become Steward Health Care. This savior narrative was appealing. Indeed, Cerberus maintains their investment rescued critical community hospitals that would have otherwise closed, saving thousands of jobs. Steward quickly expanded its Massachusetts footprint, acquiring facilities to bring their total to 10. Early reports from some acquired hospitals, like Quincy Medical Center, showed initial improvements in appearance and equipment, and employees expressed relief at having a financially stable owner. However, this expansion came under the watchful eye of Massachusetts regulators, who approved the initial Caritas deal with conditions, including a 5-year monitoring period and commitments to maintain employment and keep hospitals open. But turning local, Catholic-run hospitals into a for-profit business run by a private equity firm planning to make money fast set up a natural conflict. The focus quickly shifted from helping patients to making money. An early, ominous sign was the fate of Quincy Medical Center. Despite a commitment to the Massachusetts Attorney General to keep it open for at least 6.5 years, Steward announced its closure in November 2014, just 3 years after its acquisition. This breach of a significant public commitment foreshadowed a pattern of prioritizing financial considerations over community obligations and regulatory agreements, a pattern that would come to define Steward's troubled trajectory. The defining move that powered Steward Health Care's rapid rise and, ultimately, helped set it on a path to collapse was a tactic known as a sale-leaseback. In 2016, Steward executed what the Boston Globe described as a chain-defining deal. They sold the land and buildings of the 9 Massachusetts hospitals to a real estate investment trust, also known as a REIT. An Alabama-based REIT named Medical Properties Trust, or MPT, purchased the properties for $1.25 billion. In a sale-leaseback, a company sells its physical assets, often real estate, to a landlord, then leases them back in order to keep operating. It's a way to generate fast cash without technically taking on debt. But the trade-off is a long-term obligation to pay rent, often at premium rates. Steward's arrangement was no exception. The company got an immediate cash infusion, but shackled itself to rising rent payments. MPT, for its part, paid significantly more than what Cerberus, Steward's private equity backer had paid for those same properties just a few years earlier. That inflated pricing allowed MPT to charge equally inflated rent to Steward. So, where did the $1.25 billion go? Not back into hospitals. According to court filings and internal financials, De La Torre and his leadership team collected a $70 million dividend payout shortly after the deal closed. Cerberus also took a large cut. Instead of upgrading equipment, increasing staffing, or bolstering emergency reserves, a substantial chunk of the windfall was used to reward executives, distribute returns to investors, and finance further acquisitions. MPT also invested an additional $50 million in Steward itself, deepening its financial entanglement with the system. In 2017, Steward acquired Steward Health Care for $1.9 billion, adding 18 hospitals across 6 states. MPT once again played a central role, fronting $1.4 billion for the real estate and leasing it all back to Steward. With that single deal, Steward became the largest private for-profit hospital operator in the country. Publicly, executives promoted this as an asset-light approach, saying that by selling off hospital real estate, Steward could focus more on patient care. But in practice, the model was far more fragile. By offloading hard assets, taking on rent obligations, and extracting cash through payouts, Steward was gutting the very infrastructure it depended on. The only way to keep the machine running was to find more hospitals to acquire, sell the land, extract the proceeds, and repeat the cycle. Stop me if you think that you've heard this scheme before. The charade projected the illusion of growth. More hospitals, more markets, more headlines, but behind the scenes, the foundation was hollow. The strategy relied on continuously converting new assets into liquidity just to sustain operations. Once the flow of new acquisitions slowed and operational costs began to rise, the model started to buckle. The fixed rent payments remained, the cash was gone, and the cracks, visible in staffing cuts, supply shortages, and delayed maintenance, widened fast. MPT wasn't just a landlord. It was a vital enabler of the entire structure. It profited from each hospital acquisition, locking in high-yield leases, while Steward got the money it needed to keep expanding. But the deeper the partnership grew, the more dependent Steward became. Growth wasn't driven by improved care or better outcomes. It was driven by financial engineering, and the only road was forward, to ruin.
And right now, 5 South Florida hospitals are being acquired by a Texas-based healthcare company. That deal worth more than $1 billion. The new company is called Steward Health Care, and it says it's ready to tackle the South Florida COVID surge.
5 major local hospitals in South Florida are now under new ownership. Steward Healthcare Systems acquired Tenet Healthcare hospitals in South Florida, which includes Palmetto General, Coral Gables, Hialeah, as well as North Shore and Florida medical centers. For Steward Chairman and CEO Ralph De La Torre, it's a homecoming of sorts.
My brother lives right around the corner from North Shore. My mom lives in Coral Gables. And I have more cousins in Hialeah and Miami Springs than you can imagine. We want this to be the best health care, not only in South Florida, but in the world.
In 2021, Steward Health Care emerged from the horrors of the pandemic and turned its expansionary gaze southward, acquiring 5 hospitals in South Florida from Tenet Healthcare Corporation. Once again, MPT played a pivotal role. enabling Steward to purchase the hospital's operations for a staggering $1.1 billion. As part of the deal, MPT itself purchased the physical real estate of the 5 hospitals for approximately $900 million. However, this transaction appears to follow a familiar pattern of inflated asset values. According to Tenet's own financial reports, the company recorded a pre-tax gain of $409 million on the sale, which placed the actual book value of the assets closer to $691 million. This significant discrepancy suggests MPT paid a substantially inflated price for the real estate, a tactic consistent with its other deals that ultimately locked Steward into excessively high long-term lease payments. This entire transaction perfectly replicated the sale-leaseback model that had defined Steward's financial structure, converting physical assets into massive recurring liabilities. Despite their initial optimism, employees in South Florida began to feel the effects of Steward draining the resources from the facilities virtually overnight. The ink was barely dry on the South Florida acquisition before Steward deployed its signature financial playbook. The hospital buildings were immediately sold to MPT and leased back, instantly shackling the new facilities with the same massive rent obligations that were crippling their other hospitals. This meant that from day one, money was extraordinarily tight. The cash infusion from the sale wasn't destined for new equipment or better staffing or supplies. It was engineered to service the immense debt created by the deal itself. For employees on the ground, the effects of this financial crunch were immediate and alarming. It's crucial to understand. This wasn't the kind of supply chain disruption the world had grown used to at the height of the pandemic. This was a uniquely Steward problem. While other hospitals remained well-stocked, Steward's facilities began to bleed resources. It started with the small things. Food options in the cafeteria dwindled. The shuttle to the parking lot stopped. Then it grew more serious as key employee positions were terminated, and entire service lines began to close. Most troubling, however, was the sudden and dangerous scarcity of vital supplies. Alarm bells went off as departments tried to procure more goods and supplies, only to find their accounts were frozen. To understand how a modern hospital can simply run out of life-saving equipment, you need to know about trade credit. It's essentially a business-to-business tab. Vendors deliver supplies, syringes, IV bags, surgical tools up front, trusting the hospital to pay the bill later, typically within 30 to 90 days. This system, built on financial trust, is the lifeblood of daily hospital operations. But when that trust is broken and bills go unpaid, vendors are forced to place the hospital on a credit hold. They freeze the account and stop all shipments. For a hospital, this is a catastrophe, instantly cutting off the flow of critical supplies and directly endangering patients. Vendors tend to be kind towards hospitals, continuing delivery of goods even if a hospital falls a month or two behind on their account. But Steward was frequently behind, often 3 months or more. They didn't have enough money to be current on their account, many times paying just enough to remove the credit hold, while some vendors were never paid at all. Steward's ambitions in the region continued to grow, but so did the risks. In April 2022, they purchased the closed-down Miami Medical Center property from Nicholas Children's Health System, intending to create a 6th hospital in South Florida. This expansion represented a doubling down on a precarious financial strategy. The high-leverage, high-rent model used in previous acquisitions was already showing significant strain. By concentrating its hospitals in South Florida, Steward also concentrated its financial and operational risks. During this period, a Steward executive allegedly admitted the company was putting many expenses on the proverbial credit card and seeking quick cash, identifying the sale of hospitals as the most expedient method. They were desperately seeking a temporary respite. Just 6 weeks later, Steward attempted to sell its 5 Utah hospitals to HCA Health Care in a bid for financial relief. But the Federal Trade Commission, FTC, unanimously blocked the sale, citing antitrust concerns. The FTC argued the deal would create a regional monopoly, leading to higher patient prices and lower quality of care. The failed sale was a major blow. The deal would have provided a vital infusion of cash to service Steward's mounting debt. Losing this lifeline pushed the struggling company even closer to the brink of financial collapse. And if things couldn't get any worse, they did.
Welcome to Amaral. Not just a yacht, a declaration of outrageous, untouchable wealth. Step aboard Amaral, where the first living room leads into the second living room. Because why limit yourself to one space for sipping $6,000 bourbon while avoiding eye contact with your family? And then the 12-seat dining table, perfect for business dinners, strategic betrayals, or whispering, "We should sell that hospital over truffle risotto." Down this serpentine corridor, you'll find a bedroom so advanced, even the TV is too rich to stand upright. And yes, that is marble imported from a nation you can't pronounce, but definitely exploit economically. Whether you're sipping 1942 while dodging subpoenas or simply entertaining your favorite private equity clients, Amaral offers 1,099 gross tons of unapologetic opulence. Why settle for land-based shame when you could commit fiscal atrocities at 16 knots across international waters, built by Abbe King and Rasmussen, because your morally questionable fortune deserves German engineering? This floating fortress is Lloyd's classified and MCA compliant for the illusion of respectability. Another living room, of course, because the only thing more luxurious than comfort is redundant comfort. And up here, the sun deck. Jacuzzi hotter than your PR scandal. A bar stocked with vintage spirits and future regrets. And views that scream, "You can't afford this." No matter if you're toasting champagne with caviar or just hosting a networking event that somehow involves supermodels and lawyers, this deck has you covered. Ah yes, and here's something uniquely Amaral. A bathroom sink with mysterious red residue. Is it blood? Is it Barolo? Is it the last shred of accountability? We don't know. We don't care. That's what the 16-person crew is for. Amaral. Because if you're going to loot the healthcare system, you may as well sail off into the sunset like a Bond villain. P.S. We don't ask how you made your money. We just help you spend it.
That was the Amaral. And just a few years ago, it was purchased by Steward's CEO, Dr. Ralph de la Torre. Valued at a staggering $40 million, the 190-foot superyacht wasn't just a boat. It was a floating palace. With a full crew, multiple decks, a gym, and 6 opulent staterooms, it was the ultimate trophy for a man who had, on paper, become a titan of healthcare. As if one lavish vessel wasn't enough, he also acquired a second, a 90-foot, $15 million sport fishing yacht described as the most ambitious custom sport fish boat ever built. The question is, where did the money come from? The answer lies in the financial engineering that defined Steward's operations. 2020 marked the end game for Steward's original private equity backers, Cerberus Capital Management. After a decade of ownership, Cerberus orchestrated its exit, walking away with an estimated $800 million in profit, though Cerberus disputes the exact amount. Following their departure, the new physician-led ownership, helmed by de la Torre himself, authorized a massive $111 million dividend. A significant portion of this payout went directly into the CEO's pockets. It was this newfound liquidity that funded the purchase of the Amaral, a purchase that would become a devastating symbol of the profound disconnect between Steward's leadership and the hospitals they were supposed to be saving. Because while de la Torre sailed on the high seas, his hospitals were rotting from the inside. The money that funded his maritime fantasies could have paid for millions in overdue medical supplies. It could have hired hundreds of nurses to care for the sick. It could have repaired failing equipment and repaid countless vendors who were never paid in full. The story of the Amaral is more than just a tale of executive excess. It is the story of priorities. It is the story of a captain who bought a pleasure craft, while his flagship company had a hole in the boat, its passengers crying out for help. He fiddled, not while Rome burned, but while his hospitals, the very institutions meant to preserve life, crumbled into a state of critical condition. Across Steward's network, a grim pattern emerged. Patient safety was repeatedly compromised. These were not isolated medical errors, they were systemic failures. Almost immediately after Steward took over the South Florida hospitals from Tenet, a bitter legal dispute erupted. Tenet sued Steward in Delaware court, alleging that Steward owed nearly $18.2 million for critical information technology and data services and was, in effect, insolvent. Steward countersued, claiming Tenet owed it over $16.3 million and was obligated to continue providing the services. The court battle threatened to disrupt basic hospital functions reliant on these IT systems. A judge, finding it readily conceivable that Tenet would prevail, ordered Steward to pay Tenet $2.8 million monthly and would grant summary judgment in favor of Tenet. The Delaware Supreme Court later affirmed the court's judgment against Steward. This, on top of the existing financial squeeze, including the failed Utah sale, gave employees in South Florida a very big hint that things were not as they seemed. Problems would continue in paradise. In a truly shocking lapse of safety, the U.S. Food and Drug Administration, FDA, ordered Steward's North Shore Medical Center in Miami to stop performing mammograms in March 2024. The FDA said people who received them from North Shore may have been given inaccurate results. Potentially inaccurate mammography screenings had been conducted for 2 years, from March 2022 to March 2024. The hospital was forced to contact affected patients and offer to cover the costs of reevaluating their mammograms or providing new screenings. This occurred amidst other service cutbacks at North Shore, including the closure of its neonatal intensive care unit, labor and delivery unit, and behavioral health programs. To add insult to injury, as employees in South Florida were adjusting to this new normal, job terminations spread like wildfire across the facilities. Employees were told to promise that everyone would keep their jobs after the transition. But that promise would quickly ring hollow with how Steward did business and their own financial ineptitude. These job losses not only devastated individual livelihoods but also further depleted the healthcare workforce in affected communities, creating a vicious cycle. Understaffing leads to poorer care quality and increased stress on remaining employees, which in turn can drive further departures and exacerbate patient safety risks. Nurses were left with unsafe nurse-to-patient ratios. Managers were given entire additional departments to run on top of their existing assignments, and many employees were given promises about promotions or advancement, only to see Steward turn their backs on their word. As the situation grew more desperate, one South Florida hospital president allegedly called a town hall to assure employees that Steward had one line of credit for its vendors and another line of credit for its payroll, which was not in default as fear rumors of payroll interruptions spread across the region. Just a few hundred miles north, the systemic rot took on an almost surreal quality. Steward's Rockledge Regional Medical Center became infamous for a bat infestation. A pest control company sued Steward for an unpaid bill of over $935,000 for a bat removal process that took nearly 2 months. This obvious dereliction in basic facility maintenance created a clear and present hazard for both patients and staff, despite hospital administration saying patients were not at risk. The bat infestation was more than a bizarre anecdote. It was a visceral manifestation of systemic neglect, where funds were clearly not being allocated for essential maintenance, likely diverted to service debt or cover other pressing financial shortfalls. Additional findings, such as an extreme mold problem, as well as a busted septic pipe and corrosion, would further contribute to the hospital eventually closing under new ownership. Vendor credit holds grew increasingly severe. In Florida, hospitals were placed on hold by key suppliers, including the local blood bank, forcing surgery cancellations. Pharmaceutical wholesaler Cardinal Health froze accounts individually, so hospitals either borrowed medications from each other or ordered through facilities that still had credit. Elsewhere, the signs were even more visible. In October of 2022, Steward abruptly halted construction on a new $227 million Wadley Regional Medical Center in Texarkana, Texas. The state-of-the-art facility had been slated to open in 2024, promising a significant upgrade to healthcare services in the area. The half-finished structure stood as a monument to Steward's broken promises and deepening insolvency. Their financial woes were so profound that it could not sustain its own planned capital investments, let alone adequately fund its existing operations. For the Texarkana community, it meant unfulfilled expectations for modern healthcare facilities and a significant waste of resources already poured into the aborted project, further eroding public trust. The same occurred in Massachusetts with Norwood Hospital. After a devastating 2020 flood forced its closure, Steward began rebuilding only to abandon the project. Construction halted, contractors went unpaid, and its license expired, leaving another half-built shell where a vital community hospital was needed. Adding to the dysfunction, Steward reportedly salvaged usable medical equipment from the flood-damaged Norwood site, items not destroyed beyond repair, and redirected them to its struggling South Florida hospitals. Instead of purchasing new equipment, the company repurposed whatever it could to cut costs, raising further concerns about quality of care and stewardship of patient resources. But communities and lawmakers really started taking notice once reports of patient harm began. In September 2023, 37-year-old Jennifer Knight arrived at the emergency department of Good Samaritan Medical Center, a Steward-operated hospital in Brockton. She complained of acute chest pain and trouble breathing, believing she was experiencing a heart attack. But the department was dangerously understaffed. A triage nurse, 10 hours into a shift, handling far more patients than she could safely attend, sent Jennifer back into the registration line without performing vital checks like taking her blood pressure or pulse. 20 minutes later, Jennifer collapsed and died, still waiting. The nurse was later terminated, but the incident sparked immediate backlash from the nurses' union and state officials. Massachusetts Secretary of Health Kate Walsh and Governor Healey's office personally intervened, urging her rehiring, despite the care lapse. Nurses later described the ED environment as a hellscape, with 8 nurses managing over 90 patients, hallway stretchers, and repeated complaints going unheeded. Just 1 month later, 39-year-old Sangeeta Rashid, a new mother from Bangladesh, gave birth at St. Elizabeth's Medical Center in Brighton. Hours after delivering a healthy baby girl, she began hemorrhaging from a bleed deep in her liver. Doctors realized they needed an embolization coil, a common device used to stop internal bleeding, and essential to saving her life. But the hospital didn't have it. Steward had failed to pay the supplier, which in turn had repossessed the devices weeks earlier due to unpaid bills. Rushed to another hospital for the procedure, Sangeeta went into surgery. Despite attempts to transfer and treat her, her heart failed. The embolization coil couldn't be deployed. Her veins had collapsed, and blood loss was too severe. She died hours later, leaving behind her newborn daughter and grieving husband. Her death drew sharp criticism. A Massachusetts state investigation was launched, and Governor Healey called the incident outrageous, condemning corporate cost-cutting over patient safety. The Boston Globe Spotlight team flagged Jennifer and Sangeeta's deaths as emblematic of systemic failures, part of at least 15 preventable patient deaths tied directly to equipment shortages or understaffing across Steward's hospitals. By 2024, the financial pressures on Steward Health Care had become insurmountable. In January, their landlord, MPT, publicly stated that Steward was behind on rent payments by at least $50 million. Massachusetts Governor Maura Healey publicly lambasted Steward for its lack of transparency and demanded a plan to ensure the stability of its hospitals in the state. Steward put forth a turnaround plan, which included the proposed sale of its physician group, Stewardship Health. However, this sale faced delays and regulatory scrutiny, and experts were dubious about Steward's ability to execute a rapid recovery. The company tried to blame its dire financial state on external factors such as skyrocketing labor costs, inflation, and low Medicaid and Medicare reimbursement rates. Then on May 6, 2024, the inevitable occurred. Steward Health Care filed for Chapter 11 bankruptcy protection in the Southern District of Texas. The filing marked the largest hospital bankruptcy in decades and sent shockwaves through the healthcare industry. The scale of Steward's financial implosion was mind-boggling. The company reported over $9 billion in total liabilities. This included nearly $1 billion in unpaid bills to vendors and suppliers, who provided everything from medical equipment to food services, $290 million in unpaid wages and benefits to its own employees, and a colossal $6.6 billion in long-term rent obligations, primarily to MPT. This debacle was the direct consequence of years of leveraging assets for short-term cash through sale-leaseback deals, accumulating unsustainable financial burdens while underinvesting in core operations, all while extracting massive executive compensation. But as external economic factors definitely posed challenges, the overwhelming evidence points to Steward's business model and management priorities as the primary drivers of its collapse. As part of the bankruptcy process, Steward announced its intention to sell all 31 of its remaining U.S. hospitals in an attempt to satisfy its creditors. MPT agreed to provide initial debtor-in-possession financing of $75 million, with the possibility of an additional $225 million to keep the hospitals operating during the sale process. The immediate aftermath was chaotic and painful for the communities Steward served. Several hospitals were forced to close permanently. In Massachusetts, Kearney Hospital and Neshoba Valley Medical Center shuttered in August 2024, resulting in the loss of over 1,200 jobs and severely straining healthcare access in their respective regions. The closure of Neshoba Valley, for instance, was predicted to quadruple ambulance turnaround times and potentially lead to the collapse of a healthcare system already spread thin in the area, as local fire chiefs warned of a crisis in emergency medical response. In Florida, Rockledge Regional Medical Center, acquired by Orlando Health, announced its closure effective April 2025 due to the years of neglect seen earlier, leading to 472 layoffs. 2 more hospitals in Ohio and 1 in Pennsylvania closed, another in San Antonio, Texas. Across the country, thousands of healthcare workers lost their jobs and livelihoods, and patients faced longer travel times and reduced access to essential medical services. And to pour salt in the wounds of these communities, many of these hospitals were considered safety net hospitals, serving patient populations that were underprivileged and already facing economic challenges. On the other side of the globe, Steward was orchestrating an entirely different scheme. In 2018, the company expanded internationally, taking over a highly controversial public-private partnership to manage 3 public hospitals in the island nation of Malta. Steward inherited this concession from a company named Vitals Global Health Care, VGH, an entity with no prior experience in the healthcare sector, whose initial awarding of the contract was already rife with suspicion. Steward's international operations in Malta quickly became mired in a massive corruption scandal. Allegations surfaced of bribery, misappropriation of funds, money laundering, and a fraudulent deal to manage the hospitals. Just like in the U.S., one hospital was promised a remodel that never reopened. A Maltese court ultimately annulled the hospital concession in February 2023, declaring it tainted by fraud at all stages. leaked documents suggested, Steward agreed to pay over 15 million euros to its predecessor on the Malta contract, VGH, to avoid public criticism of the deal, including specific payouts to former VGH executives. Furthermore, as uncovered by the Organized Crime and Corruption Reporting Project, OCCRP, Steward allegedly spent millions on private intelligence firms to conduct surveillance and disinformation operations against its critics in Malta, including government officials, the head of a financial research company, and even a Steward employee. Maltese authorities eventually recommended criminal charges against Della Torre and other Steward executives in connection with the scandal.
Hey Chris, good to see you yesterday. It's Herb Holtz here. Two things. One, at Quinn Emanuel said he tried to reach you with respect to getting some help on revenue cycle witnesses for and he would still like to catch up with you. I just thought I would let you know that he's remind you that he's still looking to do that. Two, somewhat related, Quinn Emanuel, O'Dare, those are the three firms on whom we are relying for truly existential work and who will cut us off dead if we don't keep current with them. I understand that Quinn Emanuel, we're falling behind into the high six figures, and our contract with them is 30 days, by the way, although they basically give us 60 days before they start gently prodding, and then 90 before they get unhappy. And by unhappy, I define that as pencils down. We really do need to keep them high on our list of must-pays. O'Dare, Quinn Emanuel. Okay, happy to talk about any of the above. And I did just retain O'Dare today through Ralph's instruction on a spare no expenses mission. So it's going to get worse before it gets better, I'm sorry to tell you. But all the more reason that we have to keep them current. Thanks, bye.
This international dumpster fire, steeped in allegations of serious misconduct, was more than a reputational crisis. It was a significant financial drain that likely diverted critical resources from the company's U.S. operations. Malta's National Audit Office estimated that by the end of 2021, at least 214.9 million euros had been paid directly to Steward, funds that could have been a lifeline for its increasingly distressed American hospitals, funds that disappeared without a trace.
Hospitals shut down, patients without care, workers being laid off, and some of that money he used to purchase this $40 million yacht. While Steward's hospitals were severely understaffed, patients were not getting the care they desperately needed. Dr. Della Torre was able to afford this $15 million custom-made luxury fishing boat. $15 million fishing boat while patients were dying. While Steward-owned hospitals could not afford to pay for life-saving medical supplies, it had enough money to purchase a $62 million private jet and, incredibly, a $33 million backup jet that Dr. Della Torre and his family used for non-business trips throughout the world. While Steward's hospitals were laying off hundreds of workers, Della Torre made a $10 million charitable contribution to an exclusive prep school in Dallas that was fully paid for by Steward Health Care, not his own personal funds. How many of Steward's hospitals could have been prevented from closing down? How many lives could have been saved? How many healthcare workers would still have their jobs today if Dr. Della Torre spent $160 million on high-quality healthcare at the hospitals he managed instead of a yacht, 2 private jets, a luxury fishing boat, and a huge contribution to a wealthy prep school? Dr. Della Torre did not act alone. Who else besides Della Torre benefited financially as a result of Steward's bankruptcy? Cerebras, the private equity firm he partnered with, made an estimated $800 million profit from its investments in Steward Health Care. From 2017 through 2021, the CEO of Medical Properties Trust received about $70 million in bonuses, stock awards, and salary. How much of that compensation came as a result of its financial arrangements with Steward?
According to a report from the Centers for Medicare and Medicaid Services, a physician at Glenwood told a Louisiana state inspector the hospital was performing third world medicine. That's a quote. Because of management decisions resulting in limited resources at Glenwood, the state had to force the hospital to operate at 1/3 capacity. One patient died waiting for a transfer to another hospital because Glenwood lacked resources to treat. We need answers, and it seems the principal to give that answer is Dr. Ralph De La Torre.
Thank you, Senator Cassidy. And again, I want to thank you and your staff for their bipartisan efforts. As Senator Cassidy mentioned, our first witness is Dr. De La Torre. But as I think everybody can see, Dr. De La Torre is not here.
My name is Audra Sprague. I'm a registered nurse. I worked at Neshoba Valley Medical Center for 17 years. Steward Health Care systematically extracted every possible dollar that they could get out of our hospital until it led to its closure 12 days ago on August 31st, 2024.
My name's Ellen McInnes. I'm a nurse at St. Elizabeth's Medical Center in Boston. I've been there 26 years. And then Cerberus Capital came along, Steward came along, and it's been downhill since then.
Since Steward's ownership, I've witnessed personally myself some firsthand devastating effects of the company's practices of reducing overhead to financially benefit their stakeholders and their CEO with no regards for the patients and the impact on the patients and their care and the family and our staff.
The corporatization and commodification of healthcare is the guiding ethos of Steward. It's their one and only priority.
It's just the Steward has a pathological lack of concern for anyone but themselves. They do whatever is good for them.
They didn't have supplies on hand, and when they came in and put them under medical jeopardy, all the way down to basic $1, $2 supplies, things that you need for surgical care were not on hand, and patients ended up getting hurt because of that.
Under Steward, essential resources began to dwindle. Repairs that once would have been done immediately were put off and delayed. Sometimes they weren't addressed at all. Steward has a pathological lack of concern for anyone but themselves.
Sadly enough, sometimes babies die, newborn babies die, and the practice is to place the baby's remains in a bereavement box and take it to the morgue. Steward didn't pay the vendor, and there weren't any bereavement boxes. And nurses were forced to put babies' remains in cardboard shipping boxes. These nurses put their own money together and went to Amazon and brought the bereavement boxes.
Steward is either not paid or they have delayed in paying local vendors. Last November, I was contacted by a local landscaper asking if there was anything that I could do to assist in getting paid. He had been providing the services but had not been paid in several months. I said, send it over, let me see what I can do if I can help. When I got the invoice, I was surprised. It was for $72,000. And for a small business with a family and dependents and employees, that's a lot of money and could put them out of business.
The Steward's greed has put lives at risk, and their action is going to kill people.
Chronic understaffing has resulted in preventable harm and even death.
Steward has a pathological lack of concern for anyone but themselves.
2 patients at Holy Family Hospital in Methuen who died, and 2 patients died after one 81-year-old gentleman came in for chemotherapy for his pancreatic cancer, and by the time staff got to him, he was dead. There were 95 patients in that emergency department on that shift, and only 11 nurses.
That night, There are 2 nurses staffed in the ER, despite us constantly saying we needed more, and there were 18 patients in the ER that night.
It is absurd to think that 11 nurses can care for that number of patients.
So no way in the world could 2 nurses, no matter how fast they were, how hard they worked, no matter what, could care for 18 patients.
At another Steward hospital, sadly enough, a 28-year-old gentleman came in. He was in an acute mental health crisis. He was placed in restraints for his own safety, and there was nobody available to closely monitor him, which is what statute provides for. And when he went into distress, nobody was there to rescue him, and he's dead. There were nights that we didn't have any Similac or Pedialyte or even diapers. I can think of 2 separate occasions where staff went out in the middle of the night to a 24-hour store to get those supplies. Also, we frequently didn't have food, kitchens locked up, and I personally have given my dinner, my meals to patients, and staff has chipped in and sent out and had food brought in for patients. Steward has also caused the closure of Quincy Medical Center and now Neshoba and Kearney Hospital. Kearney Hospital sees more than 30,000 patients a year. Boston EMS takes 6,000 patients a year to Kearney Hospital. Where are they going to go?
Reprehensible and never should have happened.
This is how both private equity and these facilities get away with these schemes, because they put your facility in jeopardy. They shut them down. Your community has nothing, so they suffer even more. So then they can come to politicians like you and me and ask for additional bailout money and other lifelines, which to me is part of the broader crime. It is glowingly clear to me that the executives of Steward Health Group are healthcare terrorists. They are killing our patients, they are killing our communities, and they need to be held accountable. I think the problem is broader. Senator Sanders, you mentioned at the beginning of the hearing that there are other organizations involved. Medical Properties Trust, coupled with Steward, have facilitated a Ponzi-like scheme that, to me, has to be held accountable as well. Funneling billions of dollars through private equity into these healthcare delivery systems are creating criminal enterprises. I'm hopeful that this committee, after this subpoena of the CEO who no-showed, can hold him accountable, put him in jail, because that's where he deserves to be for stealing this money from all of our communities.
De La Torre's refusal to testify, ignoring a congressional subpoena after the hearing, sparked a rare moment of unity in Washington. The Senate subcommittee voted unanimously, 20-0, to hold him in both civil and criminal contempt of Congress. Then, in a move not seen since 1971, the full U.S. Senate followed suit, passing a criminal contempt resolution without a single dissenting vote. In a city known for partisan gridlock, the message was clear: no one is above oversight. Days later, on October 1st, De La Torre resigned as CEO, stepping down amid mounting pressure and legal peril. The scandal had come full circle, with Congress reclaiming its power and Steward's elusive founder finally pushed from the helm. Undaunted, De La Torre would fight back, filing lawsuits against each member of the Senate Help Committee and launching a website to defend his stance that gives new meaning to the definition of hubris. As of July 2025, he enjoys temporary protection under the executive order signed by President Trump on February 10, 2025, which paused enforcement of the Foreign Corrupt Practices Act, FCPA, for 180 days, sheltering him from fresh FCPA probes during that window. Yet the reprieve is limited. Both he and Steward Health remain under intense legal scrutiny. In a dramatic new development, Steward filed a lawsuit in the bankruptcy court in Texas, alleging De La Torre and other executives defrauded the company of over $262 million and overpaid for the South Florida hospitals discussed earlier, before the company declared bankruptcy. Overwhelming legal peril remains. Ralph De La Torre didn't just run a company into the ground, he robbed hospitals to enrich himself. Patients came to Steward hospitals for care. Many got chaos instead. Understaffed units, broken equipment, surgeries delayed or canceled. Some never made it out alive. And while all this unfolded, he was bleeding it dry. Nurses and techs were scrambling to hold things together with duct tape, while millions went to insiders, padding bonuses and funneling hospital revenue into luxury yachts and private jets. While entire communities lost their hospitals, he was at the 2024 Paris Olympics, watching equestrian dressage at the Versailles Palace. Like a monarch in exile, an image so grotesque it makes Marie Antoinette look like a humanitarian. But the damage went deeper. Small businesses, local vendors, blood banks, ambulance services were strung along for months, unpaid, and eventually left with nothing but bad debts and broken trust. Employees who spent their lives in healthcare found their careers thrown into chaos. Staff were surreptitiously fired. Surgeons left. The hospital infrastructure decimated. Entire towns were left without maternity wards, without mental health, without care. And as the system crumbled, De La Torre doubled down, daring regulators to act, gambling that the government would bail him out just to keep the hospitals open. Both he and Medical Properties Trust must have thought that health care was too big to fail. He played chicken with public health, and for a while he won. This was never about health care. It was a smash and grab wrapped in a stethoscope, a charlatan's heist. His name will not be remembered for innovation, but for devastation, for looting the public trust and betting no one would stop him. No one will care if you were a heart surgeon, doctor. You stole from the sick, the dying, the unborn. The collapse may be over. The investigation is not.
Joining us out here at the Dos Equis Beer Garden is Dr. Ralph De La Torre, the chairman and CEO of Steward Health. Welcome.
Thanks, Tom.
And best of luck next to Tom Chambers.
No,
that could be kind of a hot seat at times.
He met me in prison.